In this interview, I spoke with Dr. Lannigan. Dr. Lannigan is the chairperson of the Mental Health Special Interest Section of the American Occupational Therapy Association. In this interview, we discuss the role that occupational therapy has in general, the role that occupational therapists have in the mental health fields, how the Mental Health Special Interest Section plays a part in the occupational therapy field, and her experience working with those with mental health difficulties. I really hope you enjoy this interview and learn something from it. I particularly enjoyed this interview as I am an occupational therapy student, and it really inspired me to become an occupational therapist in the mental health field. All right, so first of all, please introduce yourself, tell a little about yourself and what you do.
Okay. My name is Liz Griffin Lannigan. I have been in the field of occupational therapy as a mental health practitioner, educator, and researcher for well over 40 years. I have experience in both acute care, inpatient, and in community-based programs. My particular interest has been in working with individuals who live with serious mental illness. And with that group of individuals, I have focused very directly on work participation, helping individuals to obtain work and to maintain work based on their interests and choices. Currently, I serve as adjunct faculty in the OT program at the University of New Hampshire, and in my volunteer leadership for the American Occupational Therapy Association, I am chair of the Mental Health Special Interest Section, and I also serve on AOTA's Commission on Practice.
Great, thank you. So to start off, just in general, what does an occupational therapist do?
So regardless of the clients, regardless of what population or disability group occupational therapy is working with, the purpose of occupational therapy is to enable people to do. And so I put do in capital letters. That is to do the range of activities that are included in their daily lives. So the thinking is that as occupational therapists, we want to enable individuals to be full participants in their community and do this through occupational engagement. So the term occupational therapy comes from the idea that every person has multiple occupations that make up their daily life. And sort of simply, that's about self-care, work or volunteerism, and leisure. The prime mission of occupational therapy is to engage people in doing these occupations in their daily lives.
Great, thank you. So what would an occupational therapist do in a mental health setting?
Absolutely, following with my last answer, it's for those people who are experiencing mental health challenges, either temporarily or long-term in their lives. Occupational therapy wants to help individuals living with mental health challenges to perform their needed and wanted occupations. So that serves across self-care, work, and leisure. Specifically, occupational therapy practitioners, which includes occupational therapists and occupational therapy assistants, analyze the occupations that the individuals are finding challenging. What are they having difficulty engaging in? And then once the challenge point is identified, occupational therapists and occupational therapy assistants develop methods to help these individuals gradually increase their skills and abilities to perform these daily occupations. What's really important in occupational therapy is to start where the person is in that particular moment and assist the person to be able to improve or grow to be better able to engage in these occupations in their own communities.
Great, thank you. So now, if you could elaborate on your career experiences working in mental health settings.
So as I said in the beginning, I've worked in both acute care, inpatient, and community-based. As I began my career, I worked in both short-term and long-term acute care facilities. That was at a time when clients stayed in these inpatient settings for much longer periods. But that enabled myself and other occupational therapy practitioners to work with clients over time to help them build these skills for performance and engagement community living. Later, I moved to providing OT services and community-based programs. In some cases, I provided direct services or interventions to clients. In other cases, I served more as a consultant to help these settings or agencies develop supports and programs for clients who were already living in the community. As time went on, I began to consider that while I felt wonderful about being able to assist these individuals, that perhaps I could have a wider impact if I moved into education and taught occupational therapy students how to develop services for clients living with mental health challenges. I felt that perhaps I could reach a wider number of clients and help them. So as I sought to prepare students, I had two really important concepts in my thinking. And one was to help students understand the life experience of people living with mental health challenges so that they could respect and support those individuals and understand a segment of society that lives with a lot of stigma due to lack of understanding. And then as I enable students to understand the life of these individuals, I also worked thoroughly to help students develop the necessary knowledge and skills to provide best quality services to these individuals.
So for the next question, what kinds of improvements, changes, etc. have you seen in people that you have worked with through the years regarding their mental health? And how did they get there?
Okay. I think many of us have our sort of meaningful client stories, those clients that we've worked with and have stuck with us in our own thinking that help demonstrate, what we've been able to do. So I'd like to talk about a woman that I'm going to call Helen. She was somebody that I worked with earlier in my career, and her story stays with me. Helen was a person who lived with a major depressive disorder. She had experienced hospitalizations both in state psychiatric hospitals and then in acute care units of general hospitals as those developed in terms of opportunities for mental health care. Helen was somebody who had devoted the majority of her adult life to her family. She married early, had a number of children very early, and she really dedicated that as her main role. Her husband worked nights. He wasn't available to be as active in the parenting roles, so Helen carried most of that responsibility. By the time I met Helen, her children were mostly grown and out of the house, and while she had experienced episodes of depression throughout her adult life, I was now seeing her at the point at which her parenting role was greatly changed. She was very much engaged with her adult children, but she didn't have those, more demanding parenting responsibilities. And when I first met her, she expressed to me the idea that she didn't feel like she could do much. In this particular hospitalization, She was not managing to take care of her own self-care and wasn't involved in other occupations. So I began with trying to match the level of activities to what she could do in the moment, what she could perform. So I began to think about what I thought were less demanding activities, not beneath her ability, but to match her ability at the moment. And then gradually, as she accomplished each activity, I was able to help her move into more demanding activities. At one particular time, when she felt really challenged by the activity that I suggested she perform, she struggled. She managed to finish it. And she looked at me with sort of this disbelief in her facial expression and said, "You knew I could do this." Um, and absolutely, because occupational therapy understands how to analyze activities and structure activities to the level to match the client, yes, I was confident that she could do it. But what stuck with me was her sudden realization that not only she had accomplished it, but that I knew she could do it. She continued through the rest of the occupational therapies interventions that I offered her, and she began thinking about what was she going to do to spend her time, to occupy her life. She had not had a worker role since before she was married. But she began to attend what I'm calling or titling a work exploration group. And the idea and the purpose of this group was to help individuals think about how to move into work opportunities or work activities and how to maintain themselves. So what skills would they need to obtain a job and what skills would they need to maintain a job? And this was not limited to just paid employment. We also talked about volunteer activities. Helen's breakthrough was when she obtained a volunteer job. This was after she left the current hospitalization, but she called me later to tell me of this achievement. There was such a difference in her voice. Her voice was full of pride and accomplishment that she had done this. And so there wasn't really one moment in time when she made a major step forward, but it was many little steps to get there. And I think that tells the story of occupational therapy because we assist clients to move through these interventions within occupations or activities to help the client move forward.
Great, thank you. It's a great story. So our next question, can you describe what role the mental health special interest section has in the occupational therapy field?
So the American Occupational Therapy has the mental health special interest section, which is designed to assist members who are in mental health practice. The intent of the mental health special interest section is to provide members with support to address mental health occupational therapy trends and issues. So we support members in general issues and trends in the greater mental health practice, but we also support these members in specifics to occupational therapy mental health practice. So the committee is formed of not only myself as chair, but 8 coordinators that each have different responsibilities and follow through on those tasks. But we also operate as a whole. And so we have a lot of conversation about what issues or concerns we need to be addressing. This means that as a whole committee, we need to be listening to members and being aware of the challenges and barriers and successes in occupational therapy mental health practice. one of the critical features, currently is, as a broad organization and for individual practitioners, the mental health special interest section is aware that we seek to expand occupational therapy practice in mental health. So that means working with practitioners and helping them find jobs or employment in various mental health settings, both inpatient and community-based. But it also means working with the association and mental health agencies, with policymakers, with reimbursement agencies, all as a collective effort to recognize the contribution of occupational therapy and to identify the distinct value of what OT provides in collaboration with all of the other mental health professionals that are serving the needs of these clients. So in terms of specific tasks, the Mental Health Special Interest Section Committee focuses on specialized mental health settings for those who have identified mental health diagnoses, and we work more broadly to assist all people in society through efforts for mental health promotion and mental health prevention. In promotion, we're really looking towards how can we support positive mental health in all members of society. In prevention, we're looking at people who might be at risk. I think about both children and adults who experience bullying. They're a population that is at risk. And so occupational therapy can provide interventions to prevent development of identified mental illnesses. The important thing in terms of mental health practice is that we cover the entire age spectrum, from the time that infant arrives through childhood, teenage years, and through the entire adult lifespan. And it's really important to recognize what might be the different challenges to taking care of oneself and one's own mental health across the age spectrum and across different members of society. So what I've just described is that we also address or provide services to people without disabilities, the people that we call the well population. In the midst of COVID-19, this is a real issue. People who have never lived with a temporary or long-term challenge in the mental health arena are experiencing a lot of challenges in taking care of themselves and their own mental health. And so that's something that OT mental health practice can address. So specifically, the mental health special interest section is concerned with engaging all practitioners in what's best practice for mental health OT services, and that's utilizing research and the application of evidence. So one of our activities is to provide this knowledge and understanding of how to apply it in specific practice in different settings, so practitioners can use the evidence as it's evolving. And finally, the mental health special interest section supports both education and advocacy efforts because it's really critical for the broader healthcare arena and the mental health care arena to learn and include occupational therapy to provide good services for clients.
Thank you. So next question, how has working with clients with mental illnesses impacted your own mental health and how you take care of yourself?
I think for me, over time, I've recognized how hard it is for any person, without a mental illness diagnosis and those who live with mental illness diagnosis, how hard it is to recognize your own struggles and how hard it is to then take step forwards to take care of oneself. And this is compounded by the lack of understanding in society and the resulting stigmas about people who live with mental illness. But for me, as I realized that this is a hard task to recognize one's own mental health struggles and to take care of it, I have tried to enable myself to pay attention to who I am in the moment, to recognize when I'm stressed, to recognize when I'm challenged, and to recognize the way I respond. You know, sometimes it's greater fatigue, sometimes it's irritability. This is part of the human existence. But being able to recognize and identify these things in myself, then I'm in a better place to say, well, what can I do to help myself? And I think, to me, learning to take care of myself and my own mental health needs is my sort of takeaway from working with clients with mental health challenges all of these years.
That's awesome. Thank you for being honest. All right, so is there any research, new developments, or anything else that you are working on or are currently working on? Planning on.
In terms of research and development, previously, as I was working with clients with serious mental illness, most of my research focused on work participation that I talked about before. I particularly focused on how clients were able to engage in different rehabilitation programs to support them moving back into work or into work for the first time. The research developments over 20 or 30 years have identified the critically beneficial approach of supportive employment, which is a comprehensive support to people as they move through rehabilitation into work. And supportive employment happens in competitive work environments, so clients are helped in real work settings as opposed to simulated work settings. So much of my research was about clients engaging in supported work programs. More recently, I have been involved with helping occupational therapy mental health practitioners apply research across many different topics to practice so that they could provide best practice in their settings. In 2019, I co-authored the American Occupational Therapy OT practice guidelines for individuals living with serious mental illness that I co-authored with Susan Noyes. This practice guideline followed systematic reviews of existing research and the evidence produced for 5 different broad research and practice questions. This was a challenging but very interesting project to learn about and write about current evidence. And having completed that project, I have been able to present at conferences and develop webinars to help practitioners utilize the evidence described in the practice guidelines with the purpose of being able to implement evidence-based occupational therapy mental health interventions, excuse me.